Hi, good morning, everyone, and welcome to the Partnerships Facebook Live. My name is Julie Yerkes, and I'm the Community Engagement Lead for the Partnership at Drug Free New Hampshire. So thanks for joining us today in our Facebook Lives, where we explore emerging topics and current prevention initiatives around the state of New Hampshire. If you are watching right now, go ahead and let us know where from and give us a little hello in the chat where you're from and what you're up to. So I just wanted to start by recognizing that this week is National Prevention Week, and which is a SAMHSA initiative, and SAMHSA is the Substance Abuse and Mental Health Services Administration. It's a public education platform that showcases the work of communities and organizations across the country dedicated to raising awareness about the importance of substance misuse and positive mental health. And it really recognizes the important work of it recognizes that the important work of prevention happens every day, which we know in New Hampshire is so true because our many partners in prevention are tirelessly working every day to promote positive mental health and reduce substance use. And Julianne's going to put some information in the chat around SAMHSA's Prevention Week, as well as the work that we're doing at the partnership to elevate our partners. So to that end, I'm really excited to have Andrea Smith here with us today. And Andrea is a substance misuse prevention coordinator through community health improvement at Dartmouth Hitchcock Medical Center. And that was a lot. And you should see under her email signature, there's a lot going on there. So that is kind of a testament of that partnership, how a lot of different community pieces are coming together to support prevention. So thank you and welcome, Andrea.
Hi, Julie. Thank you. Thanks for having me.
So first, what is a substance misuse prevention coordinator?
Yeah, that's a really good question, Julie. So in New Hampshire, instead of having county public health departments, there are actually 13 regional public health networks which work with a variety of sectors to address complex public health needs. So each regional public health network has a substance misuse prevention coordinator. And our job really is to ensure that our regional public health network has the adequate prevention resources to protect and improve the health of the public. So some ways that we do this is through engaging the 6 core sectors in prevention. And those 6 core sectors are business, community supports, education, government, healthcare, and then law enforcement and safety. So what that might look like is we might be presenting the youth risk behavior survey data to a local school board, or maybe we are working with law enforcement during National Prescription Drug Take-Back Day events. We also raise awareness and knowledge about the extent of substance use within the community. We talk about the effects and the impact that it might have at the community level. So this might look like tabling at events or maybe hosting parent-caregiver information nights, which is something that I've been doing recently. We also have a monthly newsletter where we provide resources about emerging issues. We also work just towards really building the community's capacity to address substance misuse. So we're always looking for new funding or just, seeking out ways to leverage existing fundings to support other agencies that are doing work similar to what we're doing. And then finally, we really compile, share, and we're using data and research for decision making. So that might look like we're supporting schools to make sure that they have access to evidence-based programs to support substance misuse prevention.
Mm-hmm.
And so many of us across New Hampshire in this role, we are credentialed with our CPS. I know you are, Julie, which is our certified prevention. That's a certified prevention specialist. And that's through the New Hampshire Prevention Certification Board. And then, another part of my role, so you said if you looked at my email signature, I've got a bunch of stuff under there. But another part of my role as a prevention coordinator in the Upper Valley is to co-facilitate All Together.
Oh, okay. Well, let's talk more about that. What is All Together?
Yeah, so altogether, it's our region, and again, in the Upper Valley, it's our regional coalition and community resource for prevention, intervention, treatment, and recovery of substance misuse and suicide. So, really, for altogether, we envision an Upper Valley region that sustains healthy, safe, and resilient youth, families, and communities. So, our goal really is to reduce the harms of substance misuse and prevent suicide in the Upper Valley region. So an interesting thing, altogether, it was originally developed in 2013. It was under a different name, but as the community needs changed and as the years went by, we turned into or kind of rebranded as Altogether. So now we currently serve 16 rural towns and one city throughout the Upper Valley. We're supported through a variety of different funding sources, and then we currently have 3 staff that co-facilitate the coalition. So, there's myself. I focus on the overall prevention. My colleague Lauren is a continuum of care facilitator. She focuses on sort of that intervention, treatment, and recovery piece of things. And then we have Hannah, who's working to really help us build our youth engagement in the region, because that's something that, over the years we've always wanted. We've wanted to increase, but we haven't really had the capacity to sort of, build that and have youth be part of this conversation, which we know is, a really important piece of that.
Absolutely. That's great. And so where do you guys meet, and where do you, tell us a little bit more of like that structure of, we know that the 3 co-facilitators, but a little more about the structure of that coalition.
Yeah, so I joined, basically as the world was shutting down. So right when COVID started is when I came into this position. So prior to COVID happening, I know that we were meeting every other month, and it was in person. We had people from all across the community. All of these different sectors that I talked about were coming to the table to be part of this, and we referred to those folks as our partners, so our Altogether partners. Since COVID happened, we obviously shifted to the virtual part of it, and we found that people really enjoyed the virtual piece. We have a little bit more engagement, but now we're looking at people are sort of craving that in-person piece again. So we've shifted now to meeting every other month. We are now meeting quarterly, and it's still virtual, but we're hoping, maybe July, maybe we'll be able to get together in person. But right now it's still just a quarterly meeting on like a Zoom platform.
Great. And there are representatives from the core sectors you said, and then are there, are people taking an active role? Like, what is a coalition? I know what that is, but what does that mean? They're coming to meetings, or what does it look like?
Yeah, so every coalition is going to function a little bit differently. So the way that we function may not be the same as somebody down in Greater Sullivan County, the way that a new coalition functions. So again, we've been doing this for, like I said, since 2013. So we've sort of shifted here and there. I will say right now our coalition at this point looks more like people are coming to us for, information sharing. They're coming to us to hear more about some of the emerging trends, to hear about what we're doing, and they're really helping us amplify our message. So we aren't necessarily having people engaging in like active volunteer things to be able to go out and do things in the community. That's what us, the 3 of us as paid staff people are really doing. We, again, are really relying on our partners to help us spread the message, to partner where we can. I talked about my coworker, Lauren. She's currently working on installing nalox boxes throughout our region and Greater Sullivan County region. So she's really relying on our partners to help support that initiative. So again, each coalition looks different, but for us, we rely on our partners to, they're the ones with the boots on the ground. They're the ones that can tell us what they're seeing and hearing, and then we're providing information back to them. So at our meetings that are now quarterly, like I mentioned, we try to have guest speakers come in to talk about topics that would be of interest to them. We always find that when we have guest speakers, that engagement goes up quite a bit. We have more people attending these meetings. But yeah, so that's kind of at this point in the Altogether life, that's where we are as a coalition right now.
Well, and it's so important, right? I mean, and that's what we do at the partnership too, right? Is, is we are listening to our partners, hearing about, right? We come and listen to, it's like you're in each of the public health networks, and then you guys all come together and kind of share what you're hearing up. And then some of the state level organizations are working to provide information and strategies towards that. And then it goes back, and then it goes back to the grant, right? So it's this wonderful system that the state of New Hampshire has kind of created to be able to have that back and forth of information from the local, grassroots, sending the message up, responses, and then down. So thanks for what you do. And I love that there's, SMPs across the state. So one of the things I really, speaking of that, that process, I wanted you to come and share a little bit about a resource that you all have created about talking to young people, talking to youth. Just a couple of years ago, SAMHSA revamped their Talk They Hear You campaign, right? Because we really recognize the importance of caring adults, parents, guardians, grandparents, teachers, coaches, right? About talking to youth, right? Caring, showing care. And in this campaign, really critically, that talking about substance use and safe choices, right? This campaign, Talk They Hear You, and we have some of those resources on our website at the partnership. It really emphasizes the importance of small, daily, conversations and check-ins. Sometimes I used to talk to parents a lot about, I did some parent education. And it's like, have you talked to your kids about drugs and alcohol? And they'd be like, yeah, we talked about it, right? Yeah. The talk, like sex, right? Like the talk. But we know that, it's these, they hear those, but then also these, they're seeing it in media, they're seeing messages everywhere. So it's important to have them pretty regularly. But you've taken that national campaign of Talk They Hear You and really added some local resources to it. And can you tell me a bit about that process that you went through, and how that came to be, and how you're using it, what your vision is for that, and I just want to learn more about that.
Yeah, sure. So every 2 years at Altogether, we collect data from what we call a community survey. So again, we put that out every 2 years. And so this survey really gives us the opportunity to get just a small glimpse into the adult perspectives around youth substance misuse and mental health perceptions. It allows us to use that data to support the sort of strategies that we decide to implement within the community. So the past few surveys that we've implemented, so again, this has been post-COVID, I would say, the results have shown us that some adults in our community really weren't having those conversations with youth about the expectations around substance use, or they indicated that they just weren't comfortable. They didn't feel prepared to have those conversations. So, in seeing that, and then we always look at the youth risk behavior survey data. And there's a question, I think it's still in there, that asks about prevention messaging, or have you had a conversation? Are expectations clear, from a parent or caregiver? So with those two pieces of data, we decided to implement SAMHSA's Talk They Hear You campaign, like you talked about. So we're putting that through various media platforms. But like you said, we really wanted to highlight the local resources in the Upper Valley as well. So what we did is we partnered with Hartford Community Coalition. So they're another coalition just across on the Vermont side of the river in the Upper Valley. And then we also partnered with an organization called Valley Court Diversion to really think about how we could bring this idea to life. So I would say conversations probably started back in maybe 2021. And at that point, people were really experiencing Zoom fatigue. We as a coalition had already offered a number of virtual trainings just about a variety of topics, and they really weren't well attended at that point. So we knew that we had to find a way to make this information easily digestible for people. We knew it needed to be a useful resource that people could maybe share with others. And then something that they could come back to when they needed it, because maybe at this point in their lives, they just didn't need the information we were sharing, but maybe in a year or two, it would be relevant to them. So we wanted them to be able to just come back and utilize it when they were ready to. So that's sort of how this idea of a short video series came to life. So through, anecdotal data, through interviews that we were conducting, and just organizational experience, we narrowed it down to the 7 sort of perspectives or resources that we really felt that parents and caregivers, really needed to know about in the community related to youth substance misuse. And we also felt that the 7 people that we talked to would really represent sort of the different stages that youth might be in when it comes to substance misuse, where people might find themselves needing some additional support. So fortunately, through some supplemental funding from SAMHSA that we have a supplemental grant, we were able to contract with a local videographer to sort of just brainstorm our vision and talk about sort of what we were looking for and how could we, again, bring this to life. So we're really proud of it. So again, it's a 7 short video series that covers perspectives from, a parent perspective of somebody that had a child with a substance use disorder. We have 2 clinicians that talk about their perspective. We have a youth voice, and then we have, the school and the emergency department. So we've got some really great perspectives. And, we know that substance use is a difficult topic to discuss. So we're really hoping that these Talking Matters video series will provide some tools, information, just anything to make it so that parents and caregivers feel less alone when trying to navigate this, and just feel a little bit more prepared, should they need some of these resources.
Absolutely. What you've heard is what I've heard as well. And, when I was doing the parent programming that I used to do, it's just not knowing what to say, not knowing how to say it, finding the time to talk, getting that, the confidence sort of to talk about having the knowledge and then the skill. And I know that for a lot of families that I used to work with, it was just, I get so, like flustered when I start talking about it, or my child, it's hard for them to sit down. And so I think there's, I watched the videos, there's just a lot of great information in there, and, understanding kind of the bigger picture, right? Of all the things that are involved in a young person's life and ways to connect with them. And one thing that struck me, and, we've been learning this more and more, but is that connection between, mental health, right, and substance use, and that us developing these relationships with our young people and these open, caring, curious, relationships with them can prevent and both of those, right? It's one of the biggest protective factors. So, and yeah, so I've really enjoyed them, and I think if we can put the YouTube channel in the chat, Julianne, for our guests to be able to access them, I think that would be great. So yeah, how are you sharing these? How do you anticipate getting these out to folks?
Yeah, so we decided, so when I talked about how we wanted this to be a useful resource, we really thought about where can this live so that people can come back to it when they need to. So we created, Altogether has a YouTube channel, so feel free to look that up. It's UV Altogether, excuse me. And so we created a playlist for it. So, there's a playlist, all 7 videos live right there. So, from there, we featured it on our various social media platforms. I mentioned we have this newsletter. We send it out, throughout all of our connections, our networks, our partners throughout the region. But we also shared it with all of our schools, hoping that they would watch the videos for themselves and then be able to reference the video if a parent or caregiver came in with, with a question, a concern, anything like that. So I personally, I utilize these videos every time that I talk to somebody out in the community, whether it's a school staff person that I'm working with them on a totally separate project, but something, comes up and it makes me think of one of our videos. If I'm doing any sort of an event and a parent comes up to me and has a question about something, I'm referring to these videos. Or if I'm just telling people about the work that I do at All Together, I share it there. I think we maybe lost Julie. Oh, there we are. I wasn't sure if it was mine or not.
No, it was totally me. And I said in our warm up that I haven't done this in over a year. I haven't clicked myself out of the studio. So my apologies. Did you keep going or did you?
I did.
Okay,
yes,
great.
I did. I didn't talk about, I just finished sort of like how we were sharing these videos. So I haven't talked about, like who I think should see them or anything like that.
Tell us who should see them.
So, really these videos are, they're really intended for parents and caregivers, but again, it's really useful information for anybody that is just connected to youth. So whether you're working with youth, you just have a loved, a youth in your life that you care about, anybody is really going to get something from these videos, some piece of information from these videos. So I encourage, anybody that's watching just to click through, look at the different perspectives that we have, and just see if there's something in there that you can take from it and pass along to somebody.
Yeah, absolutely. And I love that they're short, and they're really manageable. And you picked great guests. I've really enjoyed watching them. So
thank you. We're really proud.
Yeah. And to this, and I think where I first learned of them was one of your partners shared like a toolkit around safe celebrations. And we're in spring. It's beautiful out these last few days, and the next week even looks great, right? I see young people out and about and families having barbecues. It's so great. And then, of course, we have huge events coming up like prom and graduation and summer and, long weekends. It's just a lovely time of year for celebration and getting together. So what key messages would you like to share and about safe celebrations? And what would you want to communicate with our families, and what maybe they want to be thinking about these videos and communicating with their young people about that?
Yeah, so that's a good question. So yeah, prom and graduation time, in summertime, it's just, it's an exciting time in a teen's life. But I think we as parents, we just need to make sure that they're celebrating safely. So one of the, a great message from that Talk They Hear You campaign from SAMHSA that I really love, and this is, a message that I share quite often, is this idea of creating an exit plan with your child. So, as parents, it's so important that they know that we going to be there for them no matter what. So that's not to say that there won't be any consequences, but that just means that they know that they can come to us at any time, especially while they're out celebrating, especially if they're uncomfortable. So for instance, let's say that, your teen is at a party and they're just not comfortable with what's going on, or maybe their designated driver ended up drinking, or something like that, and they don't know how to leave, or, they don't want to kind of deal with the peer pressure or maybe getting fun of if they want to leave. So Talk They Hear You says, work on creating this exit plan ahead of time before they go to this party. So maybe deciding on a code word or a phrase, something that your child can use and say to you that indicates that they want to leave, they need you to come get them without specifically drawing attention to that. So their peers maybe don't know that, if that's something that they're concerned about. Or, before they go to this party, practice having them say out loud, no, I'll just go get a water, or I'm going to have a soda tonight. Practice saying that in a safe environment so that they're prepared if they're offered something, that they're not comfortable with when they are out celebrating safely. And then, I think another message that I want to share or just remind people of is, and I don't know that many people have heard of, but social host liability. And so, it's just really important that adults know that they're legally responsible for anything that happens to a minor who's been served alcohol or other drugs in their home. So in New Hampshire, there's like a $2,000 fine in addition to some potential jail time, when we think about social host liability. So, that's just something a lot of times people say, like, I want to have the party at my house. That way I can monitor everything. I'll take keys away, which, we appreciate that effort, but I think it's just important to know sort of the liability with that if you are the one providing alcohol or other substances to minors. So, one thing that we'll share, and I think, Julie, you just put it in there. I appreciate that, is we partnered with the Greater Sullivan County Regional Public Health Network, with the Injury Prevention Center at Dartmouth-Hitchcock Medical Center, and then Turning Points Network in Sullivan County to create a toolkit around keeping teens safe, specifically during prom and graduation season. So we developed, it's a pre-recorded informational webinar. It goes over some, I think, some current substance use trends in New Hampshire. It talks about impaired and distracted driving, ways to kind of talk to your teen. I specifically pulled resources from SAMHSA's Talk They Hear You campaign, ways to talk to them about making safe choices, how to prepare to host a party. And then we talk about, we added a piece about consent in there and why consent is so important. So Julie's put in I think you just put in the chat here, some links to not only that video that people can watch, but also this toolkit that just has a lot of different information. It's just in like a Google platform, Google Drive. So you can just go through, look at all of the information, the different resources that we share. And we think it's just another great toolkit for people to be able to reference during this big celebration time.
Great. Thank you. Yeah. Julianne's going to put those in the Facebook chat for us. So folks can access that. That's great. Yeah. What a nice, really well compiled resource. And we're at the partnership happy to share that out too, because it's so important. And we have on our website a number of other resources for parents and families. So please visit our website as well, at drugfreenewhampshire.org. And there's a parents and families section addressing this as well. And then we've recently also included a safe celebration section. So I think hopefully we're getting the message across out there in our communities that it's a fun and exciting time of year, and experiencing it safely and substance-free can be, is a reality, right? Can be done. Yeah. So that's great. Well, thank you so much for being here today, and for celebrating, these everyday actions that our prevention partners are doing. Really proud of the state that we live in and the work that is done. It's when I get to connect with our partners, it's just really encouraging and inspiring. So thanks for being here today. And for folks listening, please visit the Upper Valley website and look at all their resources as well as the partnership. And we have one last National Prevention Week event tomorrow. It is a virtual event, and the partnership has created a short video called Better Now, Life Without Substance Use. And it is 5 New Hampshire folks who have experienced substance use disorder and sort of their journey of realizing they wanted, they really wanted and needed to live a different life, and how they found sobriety and recovery. and the resources that they accessed and sort of their journey. So it's been, and 3 of those on the film will be with us tomorrow to talk about not just their experience, but why they wanted to be part of the film, right? And get this word out and share their story with others as a way of supporting and encouraging anyone who finds themselves in a similar situation. So we hope you'll join us for that tomorrow. You can register on our events page on the partnership, and enjoy the rest of this beautiful day, everyone. Enjoy that sun and the bees and the birds that are flying around out there. And I'm not mowing in May. I'm doing that no mow May. And man, there are so many cute little things flying around my yard. Anyway, that's it. Thank you. Happy day.
Thanks,
Enjoy.
Julie.
Thanks.